Hey, Sophie.
Hey.
Good to see you. Okay, so let me just jump right in. Let's welcome back, everybody. My name, of course, is Alana Hosey, and I'm a project interior designer here at HKS, one of the world's premier architecture firms. If this is your first time joining us, our Career Day series intends to introduce students and young professionals to all of the people it takes to create the built environment. Here at HKS, we design everything from sports stadiums to skyscrapers, airports, hotels, and hospitals. And we have over 1,000 people from all industries that help to make that happen. Architects, engineers, accountants, anthropologists, there's really a place for everyone here. So if this is your first time watching, we're in season 2 of our Career Day. I suggest you go check out our previous videos. I really enjoyed Josh's interview with sustainability engineer Mike Brown. And all of the videos are available on our Instagram and our YouTube page, along with a lot of really other interesting videos about design. Now, I'm actually coming to you today from the lab at our Dallas headquarters. It's devoted to exploring, generating ideas, and advancing design through research. Together, we connect systematic inquiry with creative thinking, adapting a think, make, test framework. And the reason I'm here today is because I'm chatting with our guest, Sophie Crocker. She is an architect and health researcher out of our London office. Hey, Sophie.
Hi, thank you for having me. Great to be here.
Yeah, thanks for joining us. Okay, so let's hop right into these questions. We kind of start every video here the same way. So if you went back to high school, what did you think your career would be? And at what point did you discover that research could actually be a part of a career in architecture?
I was, I guess, fortunate enough to know that I wanted to be an architect since I was 13 years old. It did take me quite a while, though, to really realize all of the different facets that kind of could be a part of a career in architecture. That it wasn't just about designing houses, but there are plenty of other structures that need designing as well.
Yeah.
And so I think it was in my master's at Edinburgh that I really discovered and focused in on my passion for healthcare design,
Mhm.
and wanting to make sure that the things I designed helped as many people as possible. Healthcare really benefits from design research
Mhm.
and being research led. And so it was that kind of introduction, or sort of focus in that area that took me to the research side of things. And that was what prompted me to do my second master's at the University of Pennsylvania, where I was able to focus on some of those other sort of associated areas in history and theory and sociology, and really kind of beef up my skills in the research arena to support my sort of applied research applied design in my career.
Nice. Okay, very interesting. And last year, as a part of the series, I don't know if you've seen it, we interviewed Casey Lindbergh. He's another
Mhm.
researcher from our Denver office. And to everybody out there watching, if you haven't seen that interview, it's definitely worth going back and checking out. His focus, though, was heavy on sociology and psychology, but I understand that you have, a different focus. So help me understand what your research focuses on and how that fits into what we do here at HKS.
Yeah, absolutely. Casey's great, but we definitely come at things from slightly different sort of side of the aisle or different backgrounds. I joined HKS, the Health Fellow, in 2018. And so that gave me an opportunity to really dive into the research of the firm. While a Health Fellow, my project was looking at the cultural differences in outpatient waiting behaviors. At HKS, we design hospital facilities all over the world, and it's really important that we make sure that we design facilities that are suitable and welcoming and appropriate for all of the different cultures and societies that we design within. We don't want to be just transplanting what we think is right in one place to everywhere around the world, although
Right.
everyone can learn from each other. So that was looking at China and the UK, and looking at the differences in there. And then at the moment, I'm working quite closely on flexible hospital design, and how we prepare our health facilities for the future, changes in technology, pandemics, which may well come again, and making sure that our facilities can cope with whatever's thrown at them.
Yeah, that's super important, especially, with what the world is dealing with right now. You talked a little bit about kind of blending research and architecture. It might be helpful if you could give our audience at home like an example of how that works. Could you tell me about a time when your research has affected how we design a project?
Yeah, so I'll use recent events as a sort of grounding for this, because I think it's something that's on everyone's minds. But over the last year, we've seen health systems all over the world really struggle to cope with serving patients from COVID-19 and continuing ongoing healthcare operations. So maintaining those treatments and tests and procedures that the regular population needs.
Hmm.
And this is leading to some facilities having to choose whether to provide pandemic-related care or regular healthcare services.
Hmm.
And this choice is just really not sustainable. It's not sustainable for public health, and it's not sustainable for business. And so we really interrogated what it takes for a facility to be able to offer both. What would a facility look like if it was able to continue regular operations and serve pandemic related care? And what we really kind of discovered or intuited was that it's the flows of people, air, and resources around a facility that really need to be separated out. You need to be able to cut those, separate those lines. And if you're able to separate them, then you're able to shut off parts of a facility and leave the rest of it to continue operating as normal. And ideally, those parts will grow and shrink as needed, depending on the severity of the situation. And we're already looking at, as an ED in America, and there's a hospital in Singapore that we're already looking at applying these principles to designing a facility. So it's really, you're thinking about different flows and separation of flows in hospital design normally, but this is an added layer to really make sure that the facilities we're designing now are future ready, and our clients are very focused on pandemic preparedness. And so really applying that and making sure that they can still serve the population as a whole rather than having to make that choice.
No, that's really interesting. I especially like how it's not just about design, it's also about the systems and the people. Incorporating the idea of air in there is something that I don't think you'd regularly think of as being a part of architecture, but it's actually a huge part of what we do, and your research proves that out. So that's really interesting to hear. Can you walk me through the education that it takes to do what you do? I know that you're an architect. Is there any additional education needed to become a researcher? Because you've got a lot of moving parts that you've had to learn how to kind of make work together. Yeah. What does it take?
So I do think that education in architecture is a really great grounding for research. You're taught how to problem solve and how to research around a subject, to learn about the communities and spaces that you're designing for. So that's a really great start. But I chose to do an extra master's, as I mentioned, in America at the University of Pennsylvania, which allowed me to study medical sociology, the history of medicine, as well as some design theory and history, which helped to supplement both my knowledge, but also research techniques and practices, learning how to analyze which articles to sort of trust more than others, or which sources to trust more than others, how to conduct a literature review, how to write a good academic paper, present at a conference, these sorts of things that are all part of being part of the research world. So I wouldn't say that it's necessary, but if you're really wanting to try and combine research and architecture, it could be useful to really look at ways to augment some of those skills,
Sure.
I would say.
Awesome. Okay. So you mentioned, that extra education kind of helped you learn how to vet out your sources and make sure that you're using reliable sources and that your literature is reputable. So I myself, I consider myself basically a Google doctor, a Google Doc, if you will. So what does it take though to become good at research? Is just being really good at Googling enough? Like, how would I pursue a career in research in a world where it seems like all of the information that you could ever want or need is basically at your fingertips?
Yeah, good question. Googling, no bad place to start. It definitely gives you a kind of introduction to what's out there. As I said, understanding how to discern which sources you can rely on and trust, and you should sort of even cite in your papers is
Hmm.
really important. But research isn't just about reading what's already out there. It's about understanding what's been said and what's been argued and what's been tested, and then deciding what your point of view is, what you think you want to test, what you think you want to argue, and pushing the discussion forward and coming up with new ideas. So I think that's the key. It's not just about knowing what's already been said. It's about adding to the conversation. And that's certainly what gets me excited about my job, is about contributing to the field and then maybe helping others as well, and not just HKS, but the
The
whole
world.
design community.
Yeah, yeah, and everybody. I couldn't agree more. And so, guys, this is the time, as y'all know, of the video where if you have questions for Sophie, if you could pop them into the chat for us, and we'll have a chance to answer any questions that you might have in real time. Um, so let's see what we have here. But I wish I could like show you guys around the lab. They're doing so
Yeah,
much cool stuff here. There's like a little sensory chamber
and
and
I was lucky
testing.
enough to visit a couple of years ago when we were still able to travel. So that was really great. Hopefully, I will get to come back again soon.
Yeah, I think that it's one of the best assets that we have here at HKS. I see that there's a general question about wellness in healthcare design. Oh, wait, here's a question. Let's see. Are both of your studios 100% back in the office? Sophie, what are you guys doing over there in London?
Well, we're still under partial restrictions in London, so we're only coming in if we're really needing certain facilities. For example, I'm coming in today for really reliable Wi-Fi so that I can do this interview. Yeah, so we're only about 10% capacity at the moment.
Okay,
Um,
nice. Yeah, in Dallas, we can be 100% because we're in Texas, but we have a flexible work program, so we don't have to come in unless we want to. You can opt in and sign up, and we have a great program here for that. Let's see. Okay. We have a question from San Francisco, and she wants to know if you could tell us more about research and funding. She's always had the idea that research can only be done when funded. Is funding a roadblock for research, Sophie?
sure, it can be. I mean, obviously, within HKS, we're a profit-making company. We want to make sure that we're not spending a lot of money on things that are not going to get a return. But I feel incredibly lucky that I'm working for a firm that does designate a not insignificant amount of funds to conducting research every year.
Mhm.
And we strategize about what's the most important things to focus on each year, and that's both globally but also regionally. So it might be different for London versus the States versus China. And so we have internal funding as a company that we decide to put towards it. And then there's also Cadre, which is our nonprofit research arm. And so sometimes projects are funded through that. And sometimes we partner up with external institutions,
Yeah,
universities or other companies, and we share the load that way. So yes, funding can be tricky, but I think we're lucky that we're in a company that's willing to invest in it.
sure. And then we have a question from Joshua Isaac. Do you think green architecture is going to become synonymous with healthcare architecture?
Interesting. I guess by green you mean sustainable.
I think so.
I would say in that sense, green architecture should just be architecture. There shouldn't even really be, you know, hopefully we'll get to the point where we're just designing that way as a baseline. and as sustainable as we can. It certainly is important in healthcare. It's important for the well-being of the staff and the patients. And also, healthcare facilities are really high consumers. So we want to make sure that we try and reduce that energy consumption as much as possible, and really invest in kind of new ways of insulating and providing energy for the buildings to make sure that they are sustainable.
Yeah. Okay, we have another question, and this might be our last one from KTOD. She says, Sophie, your educational and professional background spans the US and UK. What are some differences you've noticed in working with healthcare systems and design in those countries and or in other locations around the world?
Yeah, good question. So obviously the UK and the US have very different healthcare systems. In the UK, we have the National Health Service, so that's a free at point of contact or point of service system, whereas the US obviously has a private healthcare system, and that does make a difference to both what clients are looking for from us. In the US, you would say there's some more, you see maybe patients more as clients. You're wanting to get that return business. You're wanting to make sure that patients have a good, sounds odd, have a good time, a good experience at your health facility, and therefore will come back to your system. Whereas in the UK, obviously patient experience is very important, but as a public institution, you really kind of only have one choice. You're only going to be going to the NHS.
Sure.
You're not going to. So there is a difference in terms of how they view patients as clients or not, and also patients view themselves more as clients in the US or as consumers. And in the UK, they view themselves less so. So I'd say that's the biggest difference.
Gotcha. Okay, let's see here. One last question from A Wheatless Life. And their question is, what percentage of your work is on actual projects? So I think it's like, how much of your work, how much research that you do applies to an actual project that you're working on versus, researching for research's sake?
So I would say that it depends on the stage of the research. So the front end of a lot of research projects are very theoretical, and we're establishing the framework or establishing the principles and the ideas. And it's only later, once those are established, that we can really start to test them in a real facility. So at the moment, we've been working on this flexible hospital program or strategy for 2, maybe even coming up to 3 years. But it's only in the last year or so that we've really started to look at applying that to facilities, because it takes time. So it's hard to say a percentage, but for me, in terms of my work, I roughly do about 20% or 1 day a week on research and 4 days a week on architecture projects, and try and cross-fertilize where possible.
That's really good to know. Interesting. Okay, that answer actually surprised me. So that's really cool. Okay, well, Sophie, thank you so much for taking time out to chat with me. It's been an absolute pleasure. And I'm proud because I didn't try to do a British accent at all, and I thought I was going to slip into that at some point. But now, if you guys have enjoyed this, then you have to come back next week when Kylene Rockwell is going to talk to us about being a sustainable design engineer. So everyone out there watching, if you have more questions for Sophie or about HKS, please make sure you leave a comment on this video.